All right. Good morning, good afternoon, whenever it happens to be, wherever it is that you are. I would like to walk you through the last section of the skeletal system notes, bone injury and repair. I will let you know that there are a few pictures, as you can see by the faces of the athletes at the bottom of your screen. There are some pictures that are a little unsettling. Um, if you need to look away, look away. Bone fractures can be very painful. These two guys, you'll notice their ankles are kind of going the wrong way. And what ends up happening is that bone under pressure can fracture. This right here on the left side is, well, what if I didn't tell you? Could you pick out what bones those were by their shape? So you'll notice what's at the top of the picture. You'll notice the joint. Hopefully you can see the joint there. Look at both of the pictures. Do you see the joints versus the breaks? If you guess the one on the left is a hip, that is correct, and the one on the right is an ankle. Okay, so you can have really bad breaks. Um, Doctors are super good at putting them back together these days, thank goodness. It's pretty amazing what surgeons can do. But anyway, there are 7 types of fractures, and you will need to be able to identify these on your test. Okay, so this is one slide that you will definitely want to write down. As you write that down, you want to pay attention to what you're writing so that way you're sure to understand. I might recommend that you go to the last page in your chapter 6 packet as well, because the last page of the packet is types of fractures. All right. For your final exam, you are going to need to be able to, again, identify these by their description. Okay. Okay, so the next picture shows us the most fearsome break, and that would be a compound fracture. So this is a picture not all of you may want to see, but a compound fracture is when it breaks through the skin. Okay, so a simple fracture does not break through the skin. A compound fracture, the bone protrudes through the skin. Protrudes means to push through. All right, so as we go down this list, we already have seen a couple of these. This right here is a common fracture, okay, comminuted. Comminuted means that you are going to have multiple pieces. Okay, so two pieces, two pieces. That's a simple fracture, right? One bone is one bone. You break it in half. It's now two pieces. That is a simple fracture. All right. Now, a comminuted is when it's broken into more than two pieces. So anything more than broken half is comminuted. All right. So it's still going to be simple if it does not poke through the skin, and it is still going to be compound if it does break through the skin. Okay. These are all different ways to discuss and talk about fractures. Okay, there's a compression fracture. Vertebrae are often involved in compression fractures. You'll notice in the picture there that second vertebrae in the row has lines through it right here. Okay, so we can see that that vertebrae has been crushed. Hopefully in your mind you're thinking about right now what might be in between these, right? We don't want bone on bone. We want something in between. And hopefully you're starting to put together these pieces that we've been going through, right? This is where the intervertebral discs would be. This is where we have the strongest cartilage of all, okay? And your nerves are going to come out these little holes and go wherever it is that they need to go, all right? And I'm sorry, I just drew all of those the wrong way. They're not going to come out your back. They're going to come down your body and go wherever it is that they're going. But this right here would be your back. Okay, so the nerves come out there, and if that disc happens to slip and push on that nerve, that's where we get lots of nerve pain. All right, and if we have something broken here, which that's what we were looking at this broken vertebrae, all right, that is the crushed compression fracture, all right? So it's known as a compression fracture, sorry, yes, okay? So this is what happened to my friend when she was skydiving and hit the ground too hard. Okay, then we have spiral fractures. Spiral fractures come from a twisting motion. And if I go back up and I think about those lovely gentlemen that we saw at the very beginning there, right? They suffered from most likely spiral fractures. Okay, so this is a common sports fracture and one that we see quite often. Okay, the next is a depressed fracture. If you happened to have something hit your head, your skull can push in, and that is going to be a depressed fracture. You'll notice that these descriptions somewhat describe them, okay? The last one that is on the list that you needed to do is the green stick fracture, and of course now I'm noticing that it is not here. So that would be very bad. That would be because my slide got out of whack. So go back to the slide presentation and look at these again. So that way you can get this last slide, all right? The green stick fracture is when the break is incomplete. So we have a break on one side of the bone, but not all the way through. All right. So a green stick fracture can commonly occur in very young people, and that would be because their bones are soft. Okay. So we are going to go back and write 8 green stick. Oops, I need red. And I'm going to do green stick. All right, and that is underlined. And I'm going to go back to my blue, and I'm going to make my font a little smaller. And oh, what a bad picture to be right next to. Green stick is where the break is incomplete. All right, good. I'm glad I made that. Glad I found that. Let's go back to the green stick fracture now. All right, so here we can see on the screen the picture of the green stick fracture. They call it a green stick because if you try to break a new branch off a tree, it usually won't come. It'll snap, but it won't release. It's really hard to pull a branch off a tree. All right, so that's where they get the green stick. It didn't go all the way through. All right. Okay, so these pictures here are showing us either the epiphyseal line or where the break was. The one on the right is showing us, oh, they're both showing us breaks, I'm sorry. And you can see here that there is a significant break. And again, can you identify the body part? So is that going to be your hip? Is that going to be your hand? Could it be your foot? I'm pretty sure it's the hand, but I'm not a physician. So here are some other x-rays showing us a green stick. I'm sorry, the green stick is on this side. I don't know why I started with that one, but the green stick there, you can see that it goes through, but it doesn't go through all the way. All right, so there's that. And then we have our one in the skull. Can you guys remember what that was called? When part of the skull gets depressed in. Oh, look, I made a smiley face. Haha. Okay, so the depressed fracture, and then this one over here, T8, that should tell you what vertebrae it is, right? The T stands for thoracic, and the 8 stands for that 8th one, and we can see here that this has been compressed. Here's one that shows us how many pieces are here. How many pieces do we say? This is a comminuted ankle break, all right? So a little bit different than a sprain or a strain. This only has one bone. This is your tibia, and you can see that it is broken in a number of different places, okay? This right here is your fibula. Okay, and that's the little bone in your ankle. So we can see that one of those bones was broken. Okay, so how do we treat broken bones? Bones obviously heal. We immobilize them. If we need to, we can do surgery. Like I was saying, surgery has gotten really good, and surgeons are able to put in rods and pins when necessary. It usually takes between 6 and 8 weeks for a bone to heal itself pretty well. And if it was this hip like this, it would be a longer recovery. But I'm talking about something that might have been why this little girl is wearing her pink cast. Actually, I don't know if that's a little girl, but I'm guessing. Anyway. Okay, so how does it happen? You do need to know these 4 steps of bone repair for your test. So be sure and write them down. Make sure you understand them. Make sure that you pay attention to 1, 2, 3, and 4. Okay, so step 1, you're going to have a blood clot form. When your bone breaks, it's going to start bleeding. You're going to have intrinsic and extrinsic clotting processes that will take place to make a blood clot. Okay. Within 2 or 3 days, you're going to have large cells, stem cells, that are going to enter and they're going to start producing fibers and cartilage. If you remember in the video that I showed you, it showed this endochondrial ossification. Okay, so the fibers are going to get in there, the cartilage is going to be produced, and then we're going to have the introduction of osteoblasts. Osteoblasts are the specialized cells that are going to start making spongy bone. So you make the structure first, and then over time, you are going to have the spongy bone be remodeled into compact bone where it's necessary. And it does take several months. Okay, so you do get this callus that forms around it. You can actually see it in x-rays. If you've ever had a broken bone and they take a mid-healing x-ray, you can actually see the callus. I was able to see this on my daughter when she broke her arm. So 4 stages of bone repair. All right, I'm going to go ahead and stop this video and start another one in a moment talking about bone and joint disorders. We will start with the cleft lip and cleft palate, but that is going to end the discussion over fractures and bone repair, okay? All right, thank you.